It turns out a pandemic isn't so good for our mental health. In this episode of Life Prescription, we're going to talk to psychiatrist Dr. Laura Obler to understand how constant news of sickness as well as prolonged social isolation take its toll on our mental well-being. We're also going to hear about how her ability to practice psychiatry has been affected by all these changes, and she's going to give us some advice about good mental health practices during these difficult times.
Yeah, welcome to the life of a psychotherapist in training, where all we do is we watch videos of ourselves all day.
Yeah.
You get used to it quickly.
So do you have a setup now?
Yeah, I do. Like right now we're facing into my apartment, but normally I like turn the other way so that I'm more or less anonymous and there's nothing behind me.
So I'm not in the therapist view right now.
You're not. You're in the friend view.
Okay. Okay. That's
the
good.
friend and business meeting view.
Okay. I feel I can now disarm a little bit. You know, I don't think you're going to analyze me right now.
Good.
Yeah.
I'm not. Yeah.
Okay. All right. Well, welcome everybody. I am here with Dr. Laura Obler. She's a psychiatrist, currently in her residency. She is practicing in the hospital, in the clinic. Now she's practicing remotely too during all of this coronavirus epidemic. So Thank you for joining us.
Of course. I'm happy to be here.
We're happy to have you. How are you?
I am doing okay. I am surviving. I think like everybody, it's a stressful time and, you know, have to cope and change with everything that's going on around us.
How have you had to cope? How's your life affected? How are things different?
Well, you were recently a resident, and so you know the life of a resident. And so most of the time I spend so much time at work, and my life is kind of centered in the hospital or in the clinic, and I have this specific group of people that are around me all the time. And basically all of that has been taken away. So I'm getting super acquainted with, you know, working out of my home and trying to find activities that bring me joy by myself and trying to stay connected with people. So it's tough.
Yeah.
It can be lonely.
Yeah. Well, that's exactly why I'm so excited to have you. I want to talk to you about just exactly what you just talked about, the disruption that we're all feeling by coronavirus, by social distancing, by all these isolation policies that are protecting us, but at the same time are really, really affecting us. So, so hopefully in talking to you, we're going to learn about that. We're going to learn about how your practice as a psychiatrist is changing and what we can learn from that. So I want to see, how do like big events that are in the news that are affecting everybody's lives, like 9/11 or like a mass shooting. Can you talk about how that affects like people's psyche or people's mental well-being?
Well, I think that things like that can really have large effects on large numbers of people, even ones that weren't directly involved. I've been fortunate to not have lived through too many major, life crises. But there are some studies and some, information about how people can have increased risk of all kinds of physical ailments after suffering through an event like 9/11. Like you can have worsening medical illness, but also psychological and mental illness. PTSD is a classic thing that you hear about after someone goes through a traumatic event, either experiencing it directly or indirectly. But it's not just PTSD. People can have higher incidence of anxiety disorders, of depression. And, although we're just kind of getting started with this COVID crisis, we're not really sure how it's going to turn out. I wouldn't be surprised if you see some of those things in the aftermath of this as well.
Yeah. And like things like 9/11, like a shooting, those are one-time events, whereas this is every day. And here in the US, we're now in day, like for some states, like day more than a month, like day 40, day 45 of social isolation. And every time you turn on the news, it's the same thing. It's like this number of people die, this number of people sick. So Do you think that's so comparing a national tragedy or a big news event to one that's kind of slow rolling and constant, like how are those two different? How are those two going to play out in terms of the mental health and well-being of people?
Well, I think, I'm not really sure how it's going to play out, but I think that just that there is a negative effect on like chronic increased levels of stress. And so this is not a one day thing that was really tragic and then we have to go through a loss. This is like you're every single day experiencing this higher level of stress than you normally would, and also a higher level of distancing and lack of interaction with people, which we do need to be normal functioning persons. So I'm not really sure how that's going to affect in the long term, but that seems different to me.
Well, let's talk about that what you just brought up, like this high level of chronic stress plus the disruption of people's day-to-day lives. Like how is that going to affect our mental well-being? Not being able to do the things that we usually do, not being able to see the people that we see. So I guess how is it going to affect us? But how vital is routine, or how vital is contact with your familiars, or how is it going to affect us, and how vital are these things to having good mental health?
I think you're going to see just higher levels of anxiety and higher levels of depression at varying levels. For some people that may be minor. Even myself, I feel like throughout the day that my moods seem to be kind of more up and down than they normally are throughout a day. So I can kind of feel that on a personal level. And I've seen it in some of my patients as well, and also my colleagues. So I think you're going to see, and are already seeing, higher levels of anxiety and depression. And so, the question is kind of what can we do to mitigate that and help to minimize those effects on our mind and our mood. And there's like a lot of things that I've been telling my patients. I don't know if you want to get into some of them.
Yeah, why not?
But, one of the biggest things that I try to impart to my patients is that like anxiety and worry and sadness, these are all normal, like good things that our brains do, and they're important for survival, and they're useful at some times, and there's a reason why they've developed. But at other times they can be detrimental. They can become too much. And so kind of the first step is just like recognizing that at times it's okay to be anxious and it's okay to be worried. And when there's a massive pandemic, like that's probably one of those times that it's okay. And so if you're experiencing that, not to judge yourself and to try to just notice it and know that it's there. That's like kind of a mindfulness technique, which can be really helpful. So you take note of it and you notice it, but you try not to judge yourself too harshly for feeling that way, just like everybody else in the world is now. Yeah.
So we're all on this kind of heightened level of anxiety or alertness. And one of the ways that, or some of the ways that we can get through that is just by being mindful of that and just kind of accepting that that's normal. Like it's okay to be anxious and afraid during a pandemic.
Yeah, I think so. And a lot of my day has been like support and just kind of validation of those feelings that my patients and my friends and, people have been doing it for me too, just that everyone's having, that it is okay to be worried in this time of uncertainty. There's nothing wrong with you if you feel that way.
Yeah. So, how is this affecting your clinical practice? Let's say like on a day-to-day basis, how has constant news of pandemic, constant news of like mass death affecting your practice?
Well, do you mean like how I do my practice every day, or do you mean like how the patients are doing or how my patients are doing?
Well, I actually mean both. Let's start with how is it affecting, how is this disrupting your clinical practice?
So because, it's had,
No, well, I don't want to interrupt, but therapy involves like a close relationship with the provider. From what I know, my limited experience in psychiatry, a predictor of success is how close of a relationship you develop with the provider. That's integral.
Right.
And I mean, for me, I get a lot of value out of seeing a person in person.
Mm-hmm.
So
Mm-hmm.
how is all of this affecting how you
Yeah.
practice?
Yeah, me too. I um I get energy and excited by being with my patients in person. And so it's actually been a huge adjustment for me to switch pretty much all of my interactions, even the ones in the emergency room.
Mm.
We're almost doing everything entirely over Zoom. And it's interesting. Like, first of all, I'm in a different space, and it's kind of weird to have the patient be able to see a little bit more about my, like, my space, what different
Hmm.
place that I'm working, that's not the controlled environment of my office. So that was like a little bit anxiety provoking for me at first. I was thinking, well, what if somebody walks
Yeah.
outside the window and says something, and then they can hear that.
Yeah.
But actually, like, in doing it, I see that the patients feel the same way too, like,
Mm.
because I can see into their world. And we were just talking before about this, that I've actually kind of enjoyed some things. I've learned some nice things about my patients. Like, some of them have pets, and they've been interacting with their pets on camera. Like, their cat will jump up onto the
Yeah.
keyboard, and then you see them be super loving towards their pet, or you hear their kid in the background,
Hmm.
or so it's actually been kind of nice to get like a little snapshot of their lives that I don't get when they could come into the office. Um, so it's kind of, there can be pluses and minuses to it, because you do have like more concerns about privacy and things like that. But I've also actually enjoyed that part of it, getting to see a little bit about how they live more than
Yeah.
I normally do.
Yeah.
Um,
It's like disarming.
it
It's
is,
yeah.
yeah. Um, but traditionally, in training, like, we try to keep things pretty strict,
Yeah.
and meaning, you go into the room with the patient, you don't reveal that much about yourself personally as the therapist. You're taking like really detailed notes, or recording the session, and all of that has kind of had to be reworked
Mm.
in this situation, because um, we feel that it's super important for patients to still have access to their healthcare providers, especially their mental health care providers at this
Definitely.
time. And that's more important than, like, maybe maintaining the rigid frame of therapy that we would normally choose to
Mm.
in our training experience. So, yeah.
So even a rigid field, I wouldn't call it psychiatry a rigid field, but even a rigid field like psychiatry is having to adapt right now.
Yeah, and
Yeah.
I do feel lucky that psychiatry, I mean, out of all the fields, it is one that's like most amenable to putting things on the camera, because obviously, unlike you, I don't have to spend my whole day like doing physical exams or doing
Mm.
a lot of procedures. So that part of it, the transition has been, I think, much more smooth than some of my colleagues in other specialties.
Interesting.
Yeah.
So then, okay, so you're talking about if I needed to reach you, I could call you on your, on Zoom or on some kind
Mm-hmm.
of video chat from the comfort of my home. And I don't have to leave and violate social distancing. But what about
Mm-hmm.
inpatient practice? There's going to be people who, like you were just alluding to, have to come into the emergency room and um, who have to be brought into the hospital for treatment of their psychiatric conditions.
Mm-hmm.
Um, so my question is, how are those type of patients, those patients who have significant psychiatric disorders, how are they being affected by this like constant news
Mm-hmm.
of doom and gloom,
Mm-hmm.
and how is it changing your practice in the hospital, if it is at
Mm-hmm.
all?
Yeah, it is. I think so. We are seeing some patients have worsening of their symptoms because of the pandemic, whether that be increased anxiety or paranoia related to the sickness. Um, so we're seeing some admissions that you can see kind of have a direct relationship to that. So that's one part of it. But a lot of the admissions, I think, would have been patients that would have needed to come into the hospital either way. But how they're coming to the hospital has changed quite a bit. So we're in our hospital, we're testing people before they come in if they have COVID, and the like normal routine of the inpatient stay has been really changed. Normally, and like the inpatient unit, you have like programs throughout the day and a lot of groups, and the patients can spend time in like a common area. And a lot of that's been taken away because we wanted to limit the risk. So patients mostly stay in their rooms. There's not as many groups, and they're not allowed to have all the usual visitors that they would have. So I think that, so it's been, I think, negatively affected the inpatient environment. And so as a result, we're trying to only bring people into the hospital that like really absolutely need it.
Yeah, that's not something I would have imagined. I've even thought about, like group therapy, group activities, even just walking around the inpatient unit, saying hi to your neighbors and having people visit you. It's all canceled. Like you can't do any of that.
Right.
Interesting.
Yeah. So unfortunately, a lot of it's been taken away. But you know, the nurses, they've, I mean, they're always so wonderful, but they've stepped up so in so many ways. They've you know, I've heard of the nurses planning some of their own groups that they can, like doing special things with different patients, getting to spend a lot more time one-on-one with patients because there's not as many in the hospital. So, you know, at least where I work, the inpatient psych nurses have really been key to like maintaining the functioning of the psych wards.
That's awesome.
In this situation. Yeah.
Yeah. So that's your clinical practice, like people you're seeing remotely, people you're seeing in the hospital. What about everybody at home? How do you think, as a psychiatrist, what's your advice to people who are stuck at home, who can't leave, who, for example, my friend in New York City literally cannot walk out his door. Even if he's trying to social distance, there's so many people that just can't get outside.
Really? Wow.
Yeah.
Does he just have everything delivered, or how is
Basically,
that?
yeah.
Wow.
He said he hadn't gone outside in like 3 weeks. He just
My
can't.
gosh.
So
Wow.
how do you maintain some semblance of mental well-being in the face of just complete disruption of your day-to-day life?
Yeah. I think, well, there are a few things. One thing I think is that it is important to try to maintain a routine as best you can, particularly sleep. Like when you're stuck inside all day and you can't do things and you're not doing things and you're not expending as much energy, it's really easy for your sleep to be disrupted, for you to start going to bed at different times, to not sleep as well. And so that's something that I've really kind of been encouraging patients to try to maintain as best they can, a good sleep schedule. And unfortunately for your friend, this isn't really possible, but if you can, try to go outside at least once a day and go for a short walk, you know, while maintaining the social distancing recommendations, but just to like get a little sun. It's good for your mood. It's good for your body to move your muscles. And you might see a neighbor or two that you can wave to and say hi from across the street. But, you know, those are two of like the easiest recommendations, I think, is just to go for a walk and to try to get good sleep.
Routine sounds crucial, because if I have like a couple of days off and I have nothing to do, and I turn on Netflix, then it's like 3 a.m. and I'm not going to go to sleep until 3, and then I'm hungry. And then when I wake up, the whole next day is ruined. And then it just kind of starts turning the whole week into nothing. And then at some point I just have to just go back to work and then it kind of resets. And then the next next few weeks are okay.
Yeah. And then if you expand that into a month and you have a job where you're not like maintaining appointments, and then all of a sudden you're working at like 10 p.m., you know, you can see how it gets mixed up really quickly. And if that happens, then it is hard to maintain. It's harder to maintain sleep. It's harder to maintain like social connections if you're like up at weird hours, and all of those can have negative effect on your mood. So trying to keep your schedule as best as you can, as normal as you can, is great. If you know. Right.
routine and sleep.
I
How
think so.
how about for me? I'm extremely lucky because on my days off, I'm quarantined in this apartment with my wife. So
Mhm.
I have someone to hang out with, but not everybody has either doesn't have a partner or lives alone. What about those
Mhm.
people? What can they do?
Totally. That's a huge issue that some people live alone. Um, so for those people, I've been recommending some of my patients to just like call one person every day. And my patients, they have, varying levels of interest in actually doing that.
Hmm.
Um, but, uh, um, but I think that trying to maintain contact with your friends on the outside, your family on the outside is really important. And these days that's pretty easy, like what we're doing here is Zoom
Right.
or your phone or FaceTime or Netflix party or an online exercise class together, or whatever it is. Just having doing some things with friends and family at least once a day, I think is we're social animals and we need to stay connected in this time even when we can't physically be close.
Hmm. Just a quick break here. We finished up and I asked Dr. Obler for some personal advice, but then I quickly realized that these are things that we all need to hear. So let's get right back into it.
Okay, because you
Okay.
can put it, you're going to clip and put things in,
We'll
right?
clip it or we'll just put it all straight through and people can
Okay.
figure it out for themselves.
Yeah. Okay.
Yeah.
Well, so
Okay. Wait.
we're
So
gonna ask the question.
we were saying bye, and then all of a sudden, Laura,
Are you saying?
Dr. Obler starts giving me some very sage advice, which is, go ahead.
Okay. So I was saying that that one of the things that can be helpful for patients is, or just anybody really, I do it myself, is to remind yourself that worrying is not the same thing as problem solving. So, like
I
we
feel personally attacked when you say that. No, but really,
it's because we're all doing it.
right,
Yeah,
yeah,
it's definitely a comment on my own psyche as
right.
well. um, but um, but as long as you're taking precautions to, like all the recommendations that the CDC is telling us, what our primary care doctors are telling us, as long as you're doing those things, maintaining social distancing, um, and only going out for essential activities, then you're really doing a lot to control your safety. And any additional thoughts that you have about that, any additional worries, they're actually not going to change the outcome or like change your risk. They're just extra worries. And so to the best of your ability, the amount that you can limit that time spent worrying is just, it doesn't change your risk, but you feel a lot better. So one of the strategies I tell patients to do is to make a list of easy activities and like actually write it down, but make a list of easy activities that you can go to distract yourself if you catch yourself in the act of worrying. And they can be things like calling a friend or doing an online exercise class or watching a TV show you've been waiting for or cooking a meal. And if you just catch yourself in this cycle of worrying, you can just look at the paper and then like choose something on the list.
Hmm.
So that's one nice thing to do. Another thing you can do is you can actually like assign yourself time to worry.
Oh,
In
wow.
CBT, which is a kind of therapy that we're learning, we assign something called worry time. So if you spend a lot of time worrying all throughout the day, what you can try to do is say, you know what, I'm just going to let myself worry for 20 minutes at 5 p.m. every day. And anytime you catch yourself worrying throughout the day up until then, you can just say, all right, I'm worrying again. I'm going to try to stop. I'm going to try to do one of those things that I can do to distract myself. And then I can worry about that when it gets to be
Hmm.
time. And you can sit and you can worry for those 20 minutes as much as you want, or you can write it out in a journal as much as you want. And then when the time is up, you stop. Those are two pretty good ways to help limit the worries, which could be really distracting and, detrimental to overall mental health if you spend too much time worrying. Um, yeah.
Yeah, that's just like churning anxiety and worry
Yeah.
about whatever it is not productive.
Right.
It's not you moving towards getting rid of that worry. And so I can come up with ways to distract myself, like that list that you're talking about.
Right.
I can give myself a dedicated period, just get it out. Like
Mm-hmm.
it's like my 20 minutes to scream into a pillow kind of thing.
That's right.
So that's like helping me either like be aware of my worrying, try to change how I'm like, my stress response, I guess, like if I'm distracting myself. But what about like right now, the source of worrying? Like, what if I'm like constantly on social media or looking at the news? Like, what are your thoughts about that? How do I get rid of the source of the worrying?
Yeah, so that's another really great question and something we should have talked about earlier. I think that one of the best things people that are really worrying can do is to limit the amount of time that they spend looking at news sources or being on social media. Those things are important. It's important for us to stay connected and to like get the information that we need to know every day. But probably, and most of the time, that can be obtained in like 20 minutes once or twice a day, maybe 30 minutes maximum. So I've been recommending to my patients that they only allow themselves to read the news or watch TV, like whatever news channel they watch, for about 20 to 30 minutes once, maybe twice a day, depending on how adamant they are about needing to know. And then the rest of the time you watch fun stuff, or you call your friends, or you go for a walk, and you do something else. I think that's really important to limit, like you said, this kind of the source of everything coming at you. There's so much coming at us all the time that can really heighten the anxieties and worries. But really, we can learn everything we need to know just in a few minutes every day.
That's actually pretty fascinating. So it's like, here's a very limited window. I guess it all falls into routine. It's like, here's a limited window of when I can check on like, the news. And then here's a limited window of how much I'm allowed to worry. And then the rest of the time it's like, be productive, distract yourself. Yeah. And
yeah. And then just be, just notice if you're not doing it perfectly, like me when I check the news in the middle of the day when I'm not supposed to be.
Yeah.
And you try not to be too hard on yourself if you don't follow your plan exactly.
Yeah.
But those things can really help to lower anxiety overall, and have been working for my patients.
That's awesome.
Yeah.
Any parting words or advice?
That's all I got.
That's all I got. Okay. Well, thank you again. I'm sure if I press stop, we're going to find something really important.
Something else that we should talk about again.
Yeah. No, but seriously, thank you, Laura. Dr. Obler.
Yeah, of course. Of course.
All right. I'll talk to you soon.
If you made it to the end of the video, thank you. If you liked what you saw, please make sure to share it with your friends and family. And make sure to click that like button because it really does help people find this video. And as always, thank you for continuing to learn with me as we go through what is arguably one of the most difficult times in our modern human era. Until next time, stay safe, stay well, and I will see you soon.
Oh, where's the button?